Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. Today for January 20th, 2023, hard to believe. Joining us today is Vanessa Becker, who works at Douglas Public Health Network doing some great things in public health. And we'll get to her right after we do the COVID briefing. Again, if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org. We have a great question this week. I think it really explains a lot about the safety of the vaccine. So there is really, really good news with COVID. So, we started with this in the spring of 2020. We had a little peak in that first spring, but then terrible peaks at the winter of 2021, and then another terrible peak last year in 21-22. We're halfway through the winter now, and we just have not seen the peak. It's been really flat and really quiet. When we look in the world, we don't know what's happening in China, so let's put China off the table. But we do know in Europe, we do know in South America, we do know in Asia that COVID is really quite quiet. So much so that it's one of the lowest levels of COVID we've had since the early days in 2020. And that is really a good sign. Winter is when most respiratory viruses like COVID really circulate a lot. And that's why we worry about winter surges, but we've really not seen the winter surge. Now, we are seeing some new variants. So you'll know that Omicron has been the predominant variant starting in November of 2021. It is still the predominant variant, but now we're starting to see subvariants. So we started with the Omicron 1, and then 2, and then 4, and then 5. Now we're seeing the BX series and the XBB series, all part of the Omicron. But these are things that are really starting to take over. And every time it mutates, the surface protein mutates. And as it does, it's a little less like the ones before. I mean, think about cars as they move from model year to model year. You can still kind of tell what car it is, but they're really quite different, and you can easily pick out the difference. And so the new ones that we have now are the XBB.1.5. XBB.1.5 is a combination of two of the BA2 variants. So it's got a lot of different surface protein changes. And so the monoclonal antibodies, which were just so great during the Delta phase, really are not working as well and actually don't work at all against the XBB. Also, what we're seeing is that the vaccines, which were developed against the ancestral strain and the later Omicron strains, the BA4 and BA5, don't seem to work as well against the XBB. So this is what we're seeing, but we're not seeing a lot of disease in the world from it. We're not seeing a lot of hospitalizations. Oregon, similarly, has been really quite quiet. The number of COVID hospitalizations are down. And when we look at those COVID hospitalizations, the number of people who are really sick with it, that's in the ICU, or people who are on ventilators, is very, very low. So this is about the best news we've had in COVID in years. And when the president suggested we were at the end of the pandemic in the fall, I was a bit worried because we still had a winter to go through. But now that we've gone through a winter and it's been quiet, I think the pandemic is either over or very nearly over. And that is truly a good thing. Over the last few weeks, we've also struggled with a big spike in flu and a big spike in RSV. And indeed, the spikes in flu and RSV were really quite big this year and quite early. But the good news is both of those seem to have peaked in the end of December and are now coming down. And I will tell you, having been in the clinic this week and looked at the kids who are sick, there's still a little bit of RSV, but very little flu and very little COVID. So that is really, really good news. So the question we had this week was a news report that came out in the middle of January that suggested that one of the data monitoring systems had a little bit of a spike in ischemic strokes. That's the kind of stroke where there's a decreased blood flow to the brain, an increase in ischemic strokes in people who'd gotten the Pfizer bivalent vaccine. So let me tell you how this works. So we've got a lot of big databases in the country. We have the VA. They have a database. They follow everybody gets the vaccine. There's this vaccine safety data network, which showed the spike. And then there are a lot of big systems like Kaiser and such that follow the data in the people who've gotten the vaccine. In addition, Europe has a big system. And interestingly, probably the best system in the world is in Israel. So in Israel, when everybody is eligible for healthcare, and if you're eligible for healthcare, you have to sign up for one of 4 health maintenance organizations, or they're like CCOs. So you're with that organization, they have all of your records, they know who got the vaccine, and then they know if you've had something else like a stroke. And they've been great because they actually have the most they've got a lot of people in their database, and they're very good at looking at the data. So, for example, they were the group that showed the slight increase in myocarditis with the vaccines early on. And what they were able to show is that there's an increase in myocarditis in people who got the vaccines, but even a bigger spike in myocarditis in people who got the disease. So yes, we think the vaccine sometimes results in myocarditis, but less often and less severe than people who actually get the disease. So we've been really following the Israeli data. And what we see now is that the VSD, the Vaccine Safety Database, had a slight spike in ischemic stroke for only the Pfizer, but it didn't show up in any of the other databases. It didn't show up in the VA, didn't show up in Israel, didn't show up in other places. And with that data, it suggests that this was just a little bit of a spike. And this is what you're going to see. And so this actually, for me, is very reassuring that the databases are sensitive enough to pick up a small difference, and that people are watching this enough so that they know that it's there. We're going to find out a lot more on the 24th. When the FDA and CDC meet to talk about vaccines. So they'll have certainly all the most up-to-date data. I mean, I have what I can read in the media. They'll have the most up-to-date data. It'll be interesting to see. But still, overwhelmingly, it appears that the vaccines are safe and effective. And so we're really encouraging people to do kind of what we encourage all along. Stay home if you're sick, get a flu booster, get a COVID booster. But at this point, with disease coming down, I think we're expecting a pretty good spring. And I hope in a few weeks we can change the name of this it used to be COVID, and we'll talk about more. And so this is a great day to talk today with Vanessa. So Vanessa works at Douglas Public Health Network. So Vanessa, tell us a little bit about your background.
Yes, well, good morning and thank you. Welcome. It's nice to be here again. So I come to DPHN after being in Douglas County and Roseburg for over 20 years. I can't believe it's been that long. But moved here right after a graduate degree in epidemiology and health behavior change. And so had a long run working with many different nonprofits and government entities and health departments. Also had a thriving consulting business. And then when COVID hit, as the story goes, Dr. Bob reached out to me and said, can you come to the office? And I did. And then I was PIO, or Public Information Officer, and one of the epidemiologists at DPHN working on all things COVID.
And you did a great job. I think one of the things that in retrospect, that Douglas County did very well is we got information out. We got information out quickly. We were usually first and correct. We had very, very few things we had to retract or say, oops, we got that wrong. So thank you for all of that. So your degree was in behavior change, and I know how very hard it is to get people to change behaviors. Stopping smoking, eating more healthy, exercising more, all very difficult things to do. And we in medicine have been terrible about it. But tell us about your new project that helps people to make those behavior changes.
Yes, so we launched a project through some of our state funding titled Modernization, so Public Health Modernization. That's my new role at DPHN, is coordinating our modernization efforts. And one of those projects within modernization at DPHN has been to roll out some training programs for healthcare providers, substance abuse counselors, dentists, anybody who's working with people, patients, to help motivate folks and empower folks to make behavior changes. And so we contracted with a actually world-renowned national and national trainer in motivational interviewing. Motivational interviewing is a technique that is shown over many years. I learned first about it in graduate school, but it's an evidence-based program, and it really looks at how can we tap into and empower our patients to make changes that they know that they need to make, right? So we all know that smoking is bad. We know that eating fast food every day is not good, but we all have our habits and we have our behaviors. And so sometimes those get to a point where a healthcare provider intervenes and says, you've got to stop smoking, or you've got to stop eating McDonald's every day. And so instead of just saying you've got to stop it, motivational interviewing provides skills to the provider, whether it's a physician or a nurse or a dentist or a substance abuse counselor, provides those skills to help figure out how to meet that patient where they're at, figure out what kind of behavior change they are willing and able to make, and then support them in that process. So instead of just saying you've got to stop smoking, it's a conversation that the provider has with the patient about, well, are you aware of the dangers of smoking? And let's talk about, what we can do about that.
Yeah, I think doctors have not always been good at that. I've certainly heard people say, how stupid can you be? You're going to kill yourself smoking. And believe it or not, that is not very effective in getting people to stop. So what might you do? How might you approach, say, a person like me, a person in their mid-60s? I don't smoke, but let's say I was still smoking in my mid-60s, a really dangerous time for somebody to continue to smoke.
Yeah, so you want to start with listening, and several of the skills and skill developments that our trainer that came last week and is coming back again next week to work with a pretty big group of providers in Douglas County. One of the things that they start with, and they describe in motivational interviewing skills, is having empathy and listening. So asking questions, being curious, saying, and approaching it, instead of just saying you've got to stop smoking or you're going to die, right? It's more of, tell me a little bit about what smoking does for you. And, one of the case studies that we learned about last week at the training was exactly that. It was a video of a provider telling a mom that she needed to stop smoking. So the first ineffective way was, you've got to stop smoking or you're going to kill your baby. And so, of course, immediately the mom shut down and was like, I'm not going to go there. The more appropriate motivational interviewing technique was, well, tell me about why, what you get out of smoking. And she said, well, I get relaxation and I get some reducing of stress, and it's the only time I can breathe and be by myself. And so the physician then approached it that way and said, well, let's figure out some other ways that you can do that. And then I can also give you some resources for smoking cessation. And have you stopped smoking before? How did that go? What didn't work? Let's figure out how we can reduce that barrier. So really it's more of a listening activity and providing some compassion and empathy as opposed to judgment.
Yeah. And I think in many times, for example, with smoking, that people have not recognized that smoking for many people does give them that 5-minute relaxation. My mom was a smoker for many years. She stopped. And she said it would be bustling as all the kids were trying to get out of the house and making breakfast and making lunches and getting things ready. And that her most joyful time of the day was the kids were out of the house. She would sit, read the newspaper, have a cup of coffee and a smoke. And that for her was tremendously relaxing. And so I think we don't always recognize that many of these habits that develop for other reasons. I mean, people eat fast food sometimes because they're busy or they're on the run or they don't know how to cook. And so working with these other things is great. So tell us about the data for motivational interviewing that suggests it works better.
So I'm not a trainer, so I'm not super expert on this, but the data does show that there's exponentially more behavior change, whether it's smoking cessation, whether it's substance abuse, whether it's using seatbelts, whatever it is, however you approach it. If you approach it in a less judgmental way and in a motivational interviewing way, you're much more likely to connect with that patient, and the health outcomes, ultimate health outcomes and behavior change outcomes are significantly more. So, and all of us can think of a time where a provider, a healthcare provider or a dentist and not to pick on dentists, but I just had a dental appointment. It was great. So, and he used motivational interviewing, so it was super. But a dentist, a healthcare provider, a substance abuse counselor, or even a pastor, somebody who's being really, judgmental and saying you have to stop this. And what do? We immediately shut down. We don't want to do that, right? We're just like, well, I don't want to be told what to do. I know it's not good for me, but I do it for these reasons, and I don't see a way out of it. And so we know that that's what happens when we don't use motivational interviewing. So research does show that if you're more engaging and more empathetic and try to connect with that patient or that client, in a way that is understanding, then you can find a way through that makes sense for them so that they are ready to make that behavior change.
And I understand that this training is going to move this motivational interviewing to many people in the community. Was I right that there are over 40 people going to do this training?
Yeah, so we had actually 50 different people sign, actually 55 people sign up from all sorts of different organizations in Douglas County. And we had several of those folks participate in a 2-day, all-day session last week, and then another advanced session next week. And really, I think what's exciting about it from the DPHN perspective in public health is that in public health, we focus on both individual behavior change, right? We want people to be healthy and we want to promote health, but we also want to support our providers in helping patients to meet their health outcomes. And so this is an opportunity for us to train providers and give them the skill sets to ultimately, hopefully, impact their patients and their clients' health outcomes. So this is exciting. She's a great trainer. Catherine Snyder Northrup is her name. And she, like I said, she came and did 2 full-day sessions last week, is doing the same with the same group, 2 full-day sessions next week. And then she's also doing a community of learning where online, these folks that have gone through the training, these providers, will be able to practice with each other for 6 weeks follow-up. So it's really also a behavior change for providers too, right? So we're looking at providing some skills and some behavior change in how they practice, which I think is really exciting.
Well, I think it is. I mean, a lot of times docs would come to me and say, I feel like I'm banging my head against the wall. I yell at people to stop smoking and nobody stops. And I say, well, are you really surprised when you yell at them? Because, my experience, clearly not perfect, but when I deal with parents who are smoking and ask, well, I understand this is relaxation. What are you looking for in the future? And most young parents say, I want to see my kids grow and I want to have grandkids. And being a grandparent, I totally get that now, that it really is a great deal. And so for people who are smoking, their chance of spending many years with their grandparents is pretty low. Their chance of being able to go hunting with their grandson, their chance of being able to throw a soccer or play soccer with their granddaughter is much lower if you continue to smoke. And for many people, that can motivate them to make the changes that they need to. So this is great. Maybe we'll have the trainer on COVID conversations in a few weeks, because I understand she really is spectacular. And I think this is one of the places we need to go in medicine and in public health, is to really motivate people for behavior change, because we know that the leading causes of death in our society are frequently related to behaviors that we could change. We have smoking, inactivity, and obesity, 3 things that could be changed with motivational interviewing.
Yep.
Well, thank you again for joining us. We'll have you back again and again. You're a great guest. And for everyone else, again, and in summary, COVID is pretty quiet at this minute. Well, hopefully we're nearing the end of the pandemic, and we'll be back next week with more COVID conversations.
Great. Thank you.